If you are a veteran, you have earned benefits that most Americans will never have access to. Healthcare benefits, prescription drug benefits, disability compensation, long-term care benefits, benefits that took years of service, and in many cases years of sacrifice, to earn. But here is what most veterans don't know. The interaction between VA benefits and Medicare is not automatic. It is not seamless. And getting it wrong can cost you thousands of dollars in unnecessary premiums, unnecessary penalties, and missed benefits that you are fully entitled to. Today we are covering everything veterans need to know about how VA benefits and Medicare work together, whether you need both, whether VA coverage protects you from Medicare penalties, how to avoid the costly mistakes veterans make when they don't understand how these two programs interact, and how to get every dollar of benefits that your service has earned you. Stay with us. Welcome back to Medicare Exposed. No commissions, no plans to sell, no agenda. Just the truth about Medicare every single week. If you're new here, subscribe right now. Let's get into it. First, let's understand what VA healthcare actually is. The Department of Veterans Affairs operates one of the largest healthcare systems in the United States. Eligible veterans can receive healthcare services at VA medical centers and clinics across the country. VA healthcare covers a wide range of services, including primary care, specialty care, mental health services, prescription medications, and in some cases, long-term care. VA healthcare eligibility is based on your service history, your discharge status, your disability rating, and in some cases, your income. Not all veterans qualify for VA healthcare, and not all veterans who qualify receive the same level of benefits. The VA uses a priority group system from Priority Group 1, which includes veterans with service-connected disabilities rated 50% or higher, to Priority Group 8, which includes veterans with higher incomes and no service-connected disabilities. Your priority group determines your copays, your access to certain services, and in some cases, whether you qualify for VA healthcare at all. Understanding your priority group is the starting point for every VA and Medicare decision. Now, the question most veterans ask first: do I need Medicare if I have VA healthcare? The answer is, it depends, and the decision is more nuanced than most people realize. Here is the core issue. VA healthcare only covers care received at VA facilities, or care that the VA specifically authorizes at non-VA facilities through the VA Community Care Program. If you need medical care, and the VA cannot provide it in a timely manner, or does not offer the specific service you need, the VA may authorize you to receive that care at a community provider. But if you go to a non-VA provider without VA authorization, the VA will not pay. And if you don't have Medicare, you pay everything out of pocket. This is the gap that catches veterans off guard. They assume VA healthcare covers them everywhere. It does not. It covers them at VA facilities and at community providers with VA authorization. Everywhere else, without Medicare, they are uninsured. Does VA coverage protect you from Medicare penalties? This is one of the most important questions veterans ask, and one of the most misunderstood. The answer is, VA healthcare alone does not protect you from Medicare late enrollment penalties. Let me say that again clearly. If you rely solely on VA healthcare, and you do not enroll in Medicare Part B when you turn 65, you will face the permanent Part B late enrollment penalty when you eventually do enroll, 10% added to your premium for every 12 months you delayed permanently. VA healthcare is not considered creditable coverage for the purposes of the Medicare Part B late enrollment penalty. This surprises veterans every single year. They served their country. They earned VA healthcare. They assumed that coverage protected them from Medicare penalties. It does not. Now, there is an important exception here. If you have employer-sponsored health insurance, in addition to VA healthcare, and that employer has 20 or more employees, the employer coverage may allow you to delay Medicare Part B without penalty. But VA healthcare alone does not provide that protection. What about Part D drug coverage? This is where veterans get a genuinely valuable benefit. VA prescription drug coverage is considered creditable coverage for the purposes of the Medicare Part D late enrollment penalty, which means if you are receiving prescription medications through the VA, you can delay enrolling in a Medicare Part D plan without incurring the permanent Part D penalty. This is a significant benefit because, as we have covered throughout this channel, the Part D late enrollment penalty is 1% of the national base premium for every month you went without creditable drug coverage. VA drug coverage eliminates that exposure, but, and this is critical, you must be able to document that your VA coverage is creditable if you ever do enroll in Part D later. Keep your VA coverage documentation in a safe and accessible place. So what should veterans actually do at 65? Here is the framework. If you use VA healthcare regularly and you receive most of your care at VA facilities, you still need to seriously consider enrolling in Medicare Part B. Because if you ever need emergency care outside a VA facility, or if you need care the VA cannot provide, Medicare Part B is what protects you. The Part B premium, at $174, £70 per month, is insurance against being completely unprotected outside the VA system. For most veterans, the combination of VA healthcare and Medicare Part B provides the most comprehensive coverage available. VA for your primary and specialty care within the system, Medicare for everything outside it. If you have a high VA disability rating, priority group 1 or 2, you receive VA healthcare with no copays and comprehensive prescription coverage through the VA. In this situation, the case for enrolling in Medicare Part B is still strong for the emergency and non-VA care protection it provides, but the urgency is somewhat lower, given the comprehensiveness of your VA coverage. If you are in a lower VA priority group, with higher copays, or limited VA access, Medicare becomes even more important as a supplement to your VA coverage. The VA Community Care Program. What veterans need to know. In 2018, the VA Mission Act expanded veterans' access to community care at non-VA providers. When certain criteria are met, you may be eligible for VA community care if the VA cannot provide the care you need, the nearest VA facility is too far away, wait times at the VA exceed certain thresholds, or your specific medical needs are better served by a community provider. If you receive care through the VA Community Care Program, the VA pays the community provider directly. You do not need Medicare for that care. But if the VA denies your community care request, or if you need care urgently and cannot wait for VA authorization, Medicare is your protection. The TRICARE connection. Some veterans are also eligible for TRICARE, the healthcare program for military retirees and their families. TRICARE and Medicare interact differently than VA healthcare and Medicare. If you are eligible for TRICARE for Life, which is available to military retirees who are Medicare eligible, you must enroll in Medicare Part B to maintain TRICARE for Life coverage. TRICARE for Life then acts as a secondary payer, covering most of what Medicare doesn't pay, including deductibles and co-insurance. For military retirees with TRICARE for Life, the combination of Medicare and TRICARE provides extremely comprehensive coverage, with very low out-of-pocket costs. But you must enroll in Part B. Without Part B, you lose TRICARE for Life. Here is your complete action plan for veterans approaching 65. Step 1. Understand your VA priority group and what benefits you are entitled to. Contact your local VA medical center or go to va.gov to confirm your eligibility and priority group. Step 2. Enroll in Medicare Part A at 65. Part A is premium-free for most veterans, just like for everyone else. There is no reason to delay Part A. Step 3. Seriously consider enrolling in Medicare Part B at 65. Even if you use VA healthcare regularly, Part B protects you outside the VA system. The Part B premium is the cost of that protection. Step 4. If you receive prescription medications through the VA, you may be able to delay Part D enrollment without penalty, but document your VA drug coverage carefully in case you ever need to prove creditable coverage later. Step 5. If you are a military retiree with TRICARE, enroll in Medicare Part B at 65 without question. Losing TRICARE for life by skipping Part B is one of the most expensive mistakes a military retiree can make. Step 6. Contact your state health insurance assistance program, SHIP, or your local veterans service organization for free personalized guidance on coordinating your VA benefits and Medicare. These resources exist specifically to help veterans navigate this exact situation at no cost. Veterans gave this country their service. In return, this country provides benefits that most Americans will never have. But those benefits only protect you if you understand how to use them and how to coordinate them with the Medicare system that exists alongside them. Now you understand. Hit subscribe and turn on notifications, because next week we are covering how to read your Medicare Summary Notice, the statement Medicare sends after every medical claim, and the errors that appear on those statements, far more often than most people realize. We'll see you there.